Hi, my name is Louise Lockhart. I am originally from a small village in Bath, New Brunswick, but currently my home base is in Montreal. I'm a registered nurse, and also currently, although not at this exact second, I work in Nunavik, Quebec, with some of the Inuit communities in a community health role. And what I found in the last 8 years of working in primary care is we meet a lot of people who the best medical advice we have is to include more physical activity in their lives. And this is never news. It's not a revelation. It's just very difficult for people. And I believe that what we have available to facilitate physical activity just simply doesn't resonate, isn't accessible financially, emotionally, or physically, or within our cultural system to 82% of Canadians who are unable to meet the physical activity recommendations. And the piece of the puzzle, that I'm most passionate about is that big gap between knowing and doing. And this is where systems thinking, I think, comes in. There's a lot of mental barriers to us achieving physical activity. And currently, healthcare professionals are just saying, you should really do it. You can just start with one step. We do motivational interviewing, we set expectations, and then they go out into the public and access what they can at a time when it's most difficult. Getting exercise in your life is much more challenging than maintaining it in your life. And I feel like it's very similar to us encouraging our patients to, you should go and become a professional tennis player. And if they were like, yes, I agree. And then me just handing them a pamphlet with the rules and saying, okay, good luck. Without creating systems and support to help, become good at it or get it into their lives sustainably. One project that I created and implemented while working at McGill came about when we saw really how stressed students were when they're studying. So we put these intentional permanent stations all across the university that included silent spin bikes, and they were surrounded by a 6-foot wall of plants for privacy, so that the students could take a physical break, increase that blood flow to their brain, when they were feeling overwhelmed, when their self-talk was starting to get really negative, or they were just struggling to focus. They could jump on the bikes 10 or 15 minutes or whatever they want, and then just go back to work. It was convenient, and we made the spaces look very non-gym-like. The spin bikes were on like little Persian rugs. There's a fan there, phone chargers, things like that. And we advertised it as street clothes is all you need, no experience necessary. And so we really challenged the status quo that the exercise needs to be done at a gym in spandex, and it has to be like an hour, and you have to be skilled. And students inherently know what they're for, and they're using them, which is really great. So that's one project that I'm very proud of. And another, we took the language that counselors and nurses are talking to our patients about exercise, and we put that in an exercise class, and we called it Exercise for Mood. And we practiced learning to just reflect on how we feel better right after exercise, so that we create a more prominent neurological pathway, and etc. But it's just a new way to do an exercise class, instead of me saying, oh yes, you should go sign up for a class at the gym, which many of them had tried before. I'm aware of some concrete systems like healthcare and the finance, the fitness industry and things like that. But I'm really interested, in those things that keep that gap between knowing and doing, including how we talk about exercise in these very traditional ways of, it's for fitness and calorie burning, and how often our fitness industry is targeting certain people who look a certain way and have a certain predisposition to money or physical ability to participate. And these are all areas I think we can challenge the status quo. I know there's so much I could learn about systems, learn the language, skills, tools, understand how they're interrelated, also how to address creating movement and change in them, that I would think would be invaluable from this program. And I think now is a really good time for for me to engage in this program for sure. It's a great time for healthcare. Inactivity and mental health are huge issues. And I think novel solutions would be readily, we need novel solutions. The research field on exercise and mental health is just budding, like it's not even developed yet. And I personally am redirecting my nursing career to pursue this area full time instead of just a side hobby by engaging in a master's this fall, hopefully in an addition, as an additional stepping stone to starting to research this area more. I am someone who would be very open to learning, self-reflecting. I really like to learn about how I think. I would like to be able to understand how my experiences have developed my perspective so that I can learn to communicate beyond that with others in different ways. I'm very open to feedback, and I actually find that sometimes the things that are hardest for me to hear in some self-reflective learning are sometimes where the most growth comes, and I'm definitely willing to engage there. I want to be identifying and networking and pooling resources from diverse fields and stakeholders so that we can bring change together and challenge that status quo. But it's true, the practical approach of how to bring those people together and create that scalable, sustainable change is one of my big questions. I'm excited to bring my perspective as a healthcare professional, since I expect many other social innovations can be interrelated with our health and social services. And I'd also bring my positive attitude and yes, it would be a real privilege to attend the program. Thank you.